In manual throttling, asphyxia often plays a minor role compared to rapid cardiac arrest or cerebral anoxia. A frontal one-handed grip produces a thumb impression on one side and a cluster of 3 to 4 finger marks slanting downwards on the opposite side. Cricoid exclusivity is a key finding. Fracture of the cricoid cartilage is almost exclusively seen in manual throttling. The neck must be examined only after the brain and thoracic organs have been removed to allow venous blood to drain, creating a bloodless field to avoid artifactual hemorrhage. Superficial hemorrhage and severely engorged underlying tissues are common under the ligature mark. Deep muscles show gross bruising if a rough cord or violent struggle was involved. Internal findings often include laryngotracheal tract, deep congestion, and frothy blood-stained mucus. Cartilage fractures. The hyoid bone and thyroid cartilage may be flattened and fractured inwards. Note that thyroid fractures are more common in strangulation than in hanging. Carotid arteries. The intima is usually undamaged in strangulation. Transverse intimal tears are very rare compared to hanging. Pulmonary system. Lungs are markedly congested and edematous, frequently showing large subpleural hemorrhages. Cerebral system. The brain is heavily congested, the meninges are engorged, and subarachnoid effusions are common. Visceral organs. General deep congestion of all abdominal organs is typical. Forensic investigators must rule out natural artifacts. Infant skin folds. In short-necked infants or obese individuals, natural folds can mimic depressed ligature marks after refrigeration. Putrefactive swelling. Tissue swelling around a tight collar or tie in decomposing bodies can create an artifactual groove. Post-mortem lividity banding. Isolated patches of lividity on the neck of a prone body can resemble contusions. To determine if a ligature was placed antemortem or postmortem, look for antemortem indicators, presence of Tardieu spots, redness/congestion above the mark, and bruising into deep neck muscles. Postmortem indicators. The base of the mark is pale and yellowish without reactive hyperemia, and there is an absence of deep tissue bruising. Let's compare the defining traits of hanging versus strangulation regarding the ligature mark. Angle. Hanging is oblique and rises toward the point of suspension. Strangulation is transverse. Continuity. Hanging marks are usually incomplete, whereas strangulation marks completely encircle the neck. Anatomical position. Hanging is high up, above the thyroid cartilage. Strangulation is lower, usually at or below the thyroid cartilage. Base. Hanging is pale, hard, and parchment-like. Strangulation is soft and reddish. Further differences between hanging and strangulation include signs of struggle, extremely rare in hanging but common in strangulation. Saliva. Often runs out of the mouth in hanging but is absent in strangulation. Facial appearance. Often pale in hanging but intensely congested and cyanotic in strangulation. Fractures. Hyoid fractures may occur in both, but thyroid cartilage fractures are specifically more common in strangulation. Discharges. Involuntary discharge of feces/urine is more common in strangulation, while seminal fluid at the glands is more common in hanging. Strangulation is presumed homicidal until proven otherwise. Homicidal cases often show multiple knots and signs of struggle. Suicidal strangulation is a rarity and usually involves elaborate tightening mechanisms like a Spanish windlass. Accidental strangulation often involves environmental entanglement, such as window blind cords or machinery accidents. The final diagnosis follows a sequential model: confirm mechanical asphyxia, identify congestion, cyanosis, and Tardieu spots. Isolate neck trauma, differentiate between transverse, strangulation, oval fingertip, throttling, or oblique hanging marks. Internal dissection, assess for inward cartilage fractures and deep muscle bruising. Establish vitality, rule out postmortem staging. Manner of death verdict, cross-reference all signs of struggle and scene circumstances.